everyone. Good morning, one and all. Here is the video we at Intertech would like to present a quick demo of Healthcare Digital Regulatory Platform owned by Intertech. This application is of 4 different modules. First module, considering the customers as end users, is made available with the service request forms and all the requisitions that are available for any of the end users to raise a request. And then continued by the internal portal for the officers who can review the requests that are raised by the end users and then push the request further processing. Third module is of the inspection admin, which will be utilized by the inspection administration team and the inspection supervisor team for inspector assignment for all those requests that require an inspection as a part of a mandate. And then followed by the fourth module, which will be the last one, as a mobile app for the inspectors, which is used by the inspectors to conduct the inspection and record notes, videos, images of the site of inspection, and so on and so forth. And this report will be sent back to the internal module for further processing and further approval of the license or the permit request that is raised by the end user. Now this is the home screen, login screen for the digital regulatory platform, where the user will be requested to insert their email ID and password and further sign on. Moving on into the video. So once the user signs in, he will be navigated to the home page, the landing screen, which has a complete dashboard view. The dashboard is split across 3 different major sets, which consist of the active request, active task, and pending payments, followed by the priority services that are available for that particular establishment, followed by the announcements. Towards the right hand side panel, the user will be able to see the active licenses and the evaluations that he has conducted in past. And here you will be able to switch between a corporate, and if you want to navigate as an individual user, that will also be available. Moving on to the applications, it's again split into 2 different tabs, active and past applications. Those applications that are in progress will be available in active, and those that are completed will be available in past applications. After applications, we'll move on to my task. So here is the complete view for the customer to be able to see the list of tasks that he is currently in active with. And then moving on to the payments tab, similar to the applications, pending payments and completed payments, 2 different tabs are available. With pending payments, he get a view of all the payment that he has to take care of. Moving on to the exam module from the quick links, these are the exams that he have taken in the past. And then the certificates, the list of certificates that he is availed, and if he is a user of individual as well as corporate, in certificates, all his individual certificates will also be available. So here is the list for a corporate user, the facilities and all of the different facilities and the certificates aligned with different facilities will be available. Now let's look deep into the list of different facilities right now going into the corporate account. The existing facilities that the user currently have is of Aster Dubai, Aster Oman and Aster Sharjah with Muscat Pharmacy. Now taking up Muscat Pharmacy as our typical use case, we'll get into the dashboard of Muscat Pharmacy, where the user will be able to see complete list of facility details, including the contact details, location details, and furthermore to the owner profile and partnership information. This is a complete view of all the information that are available for Muscat Pharmacy. Now as a next step, let's look into the list of services, priority services and more services that are available for pharmacy, since we are looking at Muscat Pharmacy as our use case. Now the user can go into the workspace and look into the priority services, and from here he'll be able to apply for any request that he wanted to place for Muscat Pharmacy. For now, let's start with pharmaceutical establishments. And here he will be able to select the establishment request, and then he can navigate to the requisition form of issuing pre-licensing approval. So the form consists of multiple tabs. So the tabs are uniquely defined and dynamic for each and every request that we are placing. So for a pharmacy, the establishment details, contact details, license and vendor related details are the different tabs that we have enabled for now. And he will also be asked to fill the partner level information, self-evaluation checklist and so on and so forth. So let's just consider that request has already been placed. Now we are moving on to the dashboard again to have a look at how the application will look like when a request is raised. So we have filtered out the pre-licensing requests that we have already created for a better view. And now this is the side menu that gives a complete list of application journey, so that user is kept aware of what are the processes that he has to go through in the life cycle of the pre-request for licensing. And moving on to the dashboard majorly consists of two major criteria, majorly focusing into the capacity planning for professionals as well as facilities. Now this dashboard gives information about the capacity that is available for Muscat Pharmacy against the information that is requested against the demand. Now looking into the health ratio, that gives a complete view of what is required, again supply versus demand kind of view against doctors and the public. Demographics will give a split of male population, female population and other population. That will also be a complete demographic set of information. Now navigating back to the reports are again further classified into KPI, completed request, license issued and revenue report, and we will be able to add further more detailing as per the request from the entity for whom we will be able to enable the platform. Now the complete list of all the revenue, this can be split by medical, pharmaceutical, and furthermore definition can also be brought in based on the specialties that are enabled within a medical establishment and pharmacy establishment, and that will be applicable across all the three criteria of KPI, request, license issued and revenue report as well. Now moving on to the internal portal. So for an officer, this is how the list of tasks will be available, similar to what we saw for the customer. So from here the officer will be able to select a particular task and view the complete information of the requirement that the customer has placed in. So with that set of information, he will be able to look into the form filled by the customer, all the data that is uploaded, documents that is uploaded by the customer. So this is a view of the image that he has uploaded for the location, and followed by the further documents. You also have a separate tab for the applicant facility profile, where the internal officer will be able to have a complete view of all the information about the facility as well. So after he reviews all of the information, he can either approve it, send it back for further more information, or he can schedule an inspection if the request requires an inspection. We have selected a final license so that we will be able to display the use case of scheduling an inspection as well. So here the partner details and furthermore the request history, all of the information is rightly available here for the internal officer to have a complete review of the request about the facility as well as about the current request that the customer has placed in. Now the internal officer will have an option to add his own notes and attach any documents that are required for the inspection to be conducted, and once he has done his due diligence, he will be able to schedule the inspection from the same application, and we have a complete integration with our inspection module as well. So now here the inspection has been scheduled. We will navigate back to the inspection admin module right now to see how the further processing will take place. So this is the inspection admin module. Here is a complete view of the different criteria that are available for enabling an inspection for a particular organization or an establishment. Detailed view of the dashboards that will give complete information about the organization requests, and then a list of requests that are placed depending on the type of inspection criteria. Now this is the view where the complete live tracking of inspectors are available for the admin supervisor and the inspection admins and the supervisors to check and verify if the inspectors are navigating in the right location. So once a pin is clicked, the list of inspector details will be available. And then the inspection visit management, where all the inspection visits are pending to be completed. Now moving on to the left hand side menu, master data, where the complete setup for the organization will be done, including their holidays, establishments, language preferences, user roles, and organizational definitions, so on and so forth. Next, moving on to the settings, where the internal settings of emails, theme configuration will be available for the inspection admin to do a complete setup. Next, moving on to the preparation module. This is where the exact shift and holiday calendar, time slots for each inspection, task delegation and impersonation data when an inspector is not available for the task to be automatically assigned. All the capabilities will be available here for the inspection admin to be able to set it up to enable a seamless inspection that can be digitally managed. Roles and permissions for each and every role can be categorized and managed here. Further, moving on to the employee definition. Now, within the employee definition, you add all the employees who are enabled to conduct the inspection and also create group of inspectors wherever applicable. And then moving on to the checklist definition, all the checklist will be defined here as per the inspection category and the criteria. Inspector assignment based on the different set of organizations and departments will be available here. So specific inspectors can be assigned for specific departments and furthermore. So moving on to the schedule creation, there are 3 ways that we'll be able to create a schedule. Manually assigned, where you manually go ahead and create the inspection, and then a list of assigned requests that gets sent out from external applications like the Healthcare Regulatory Platform. And assigned are the requests. Once an inspector assignment is done, those requests will be available in the assigned criteria. Now here is where a quick view of how a request can be assigned to a specific inspector by selecting his name based on the shift and his availability is available. And these are the list of checklists that are available for this particular inspection. These are predefined using checklist definition, and an assignment date will also be selected. So this is how we select an inspector and assign the request. Now the request will be assigned back to the inspector. Moving on to the mobile application. So here the inspector will be able to navigate to this mobile application through his mobile, and then he'll be able to sign in using the credentials that is given, or we can do an Active Directory integration as well. Now for the inspector's dashboard, he will have a view of all the pending tasks and the tasks that he has completed. Profile management will also be available for the inspectors to be able to actively manage their profile and change preferences based on the language. He can choose Arabic or English based on his preference, and then the settings can be saved, which will be personalized for a specific inspector. Changing his password will also be seamless using the mobile app, and Face ID is also available. Once you enable the Face ID, the inspector will not be requested to log in using his email ID. He can do it using his Face ID itself. And the theme can also be changed based on his preference or the organization's preference. The organization can fix the theme and lock this capability for the inspector if the organization restricts the inspector to make the changes. And all the complete list of user details can be defined, which are given by the Active Directory. It can be a complete integration where the inspector can only change any qualification and certification that he takes after the profile is created. Now he'll be able to take an image and change the image as well at any point of time. So now that we have looked into the details of the profile management of the inspector, now we will navigate back to the list of requests that he is looking for. So today's task, now that we have assigned a request for Muscat Pharmacy, he will view that in his home page, and all the notifications that he has got in the past will be available here. And now the inspector will be able to select and search for a specific notification that he is looking for as well. Moving back to the notifications, this is a complete view, and he can click on any of the notification to view a complete list of details as well. Now moving back to the dashboard, from here the inspector will be able to view all the pending tasks that he needs to complete, and from here he can make a selection and start his inspection. Moving on to the Muscat Pharmacy request that is assigned for today. Now these are the list of pending tasks. So he will navigate to complete list of tasks here. Now the inspector is looking to select a particular request and go on with conducting the inspection. The first one on the list will be the Muscat Pharmacy, and he'll be able to select. Not only that, the inspector from his task list, he will also be able to do an advanced search and select specific request view as well. So this is a complete list of tasks that are available from here. So moving on to the calendar view. So here is a complete list of calendar view where all the inspections are being assigned for inspector's quick view, so that he will be able to understand on which date how many inspections are assigned. And here is where he'll be able to track his location for the Muscat Pharmacy. So from here he'll be able to select the specific establishment to which he has to conduct inspection, and he'll be able to navigate from here. A pin of all the locations for which he has an inspection assignment today. So this is a statistics view for the specific inspector on 3 different categories: today, for the day, week, and for the month. So here is a dashboard view that is also available, and that can also be adjusted according to the organization's requirement. Now moving on to the task details of Muscat Pharmacy. The inspector has navigated into the complete list, and he has navigated to the utilization of map that is available for him to travel to the specific location. So he can click on start direction, and he can click on the navigation. Now this is a list of violations that are available for Muscat Pharmacy for a quick view of the inspector to have a look and conduct his inspections accordingly. These are the checklists that has been conducted inspection for in the past, and the violations that the establishment has encountered in the past. Again, here we have a list of advanced search where the inspector will be able to search and see what are the fines that are pending from the pharmacy as well. Now having this list and all the context information available, so these are information that are pulled from the source data for the inspector to be able to view complete information of the business partners, general information, the notifications, and so on and so forth. So after he viewing all of this information, if he wants to reschedule this request in any time, any point of time, if he will not be able to conduct this request for the given particular day, he'll be able to do a rescheduling request, and this will go back to the admin, and the admin or the supervisor will take necessary action of reassignment or rescheduling the request to the same inspector or to a different inspector. Please to be noted that the inspector will only be able to request for rescheduling or reassignment. So after these capabilities, the inspector can move on to start the visit, where he will be able to do a complete visit management. Now this is the form that will be available for the inspector to fill in. So he fills in all the details of the buildings, locations, the establishment, so on and so forth, required for the inspection to be effective and to be a part of the final report. When it comes to medical and healthcare, the form will be redefined according to the criteria and the information that needs to be captured for a medical or the pharmacy establishment. So the inspector can either have it handy, or he can also have a view of the context set of information that are posed and then fill in the rest of the information and continue with his inspections. So once he fills in the form completely, he can navigate to the checklist, where he will be able to have a quick view of all the checklists that are available to be conducted inspection against. The inspector will here have options to mark the checklist compliant, non-compliant, or not applicable. So for all those non-compliant requests, the inspector will be requested to fill in his own notes and then capture specific proofs using the camera. It can either be a video or a image. And he should also select the type of violation and what has been violated. So that can be detailed out in the notes. So this free text will enable the inspector to capture information exactly to the need of the situation. So the inspector fills out all the notes, and then he will use the camera or browse files and attach a document that is available on his device that can be obtained from the organization as well. Now he uses the camera to click an image, and he can use this image to take a photo, and he can add it to the request. So this is specific to the checklist item. Once he updates this information, he will also be navigated to the final screen, where he'll be able to add general notes and general images for the particular site that he is conducting inspection for. So similar capabilities of browsing a file and attaching the file using a camera, and to be able to capture a video or an image will be available, again against the complete set of inspection that he has conducted, which is irrespective of the checklist that are available. So all of this information captured by the inspector will combine together as a note, and then a report will be generated, a final report. So all the pre-checklist items and the checklist definition, and also the non-compliance, the notes and the images, the videos, the files the inspector attaches, all of the information will be collated together as a final report. And we also take an acknowledgement from the establishment owner or the partner to make sure that their presence is also available when the inspection is conducted. So the final comments, where the inspector will put his comments on if the request is approved for license, or is compliant or non-compliant. Now going back to the admin module, where the inspection supervisor or the admin will be able to see this submitted report in the inspection visit management. So this is the complete list of report that I was talking about. So this report can be emailed, downloaded in PDF, and utilized for further processing as well. So here is where the inspection supervisor will take a final call if he wants to push it to the violation management or to proceed for further processing of the license or the permit that is requested by the user. So this is the final step. From here, the report will also be sent back to the internal portal, where the internal officer will be able to review the request and push it for further processing. Now let's have a look at the actual report that got generated. So the final report will look like this, where all the complete set of information will be available for the internal officer to view and take further actions. The logos are right now with Intertec. Once we enable it for a specific organization, the logos can be replaced according to the organizational needs. This is a final license that will get generated as a part of the request. Thank you. I hope we were able to cover the complete list. Thank you, one and all.